Hi, I'm Dr. Sebastian Gonzalez with Performance Play Sports Care here in Huntington Beach. This is an ongoing part of our video series on just digging into the research. I pulled another article today which is on the knee. This might be interesting mainly for people who think they have a meniscus injury, which is a cartilage of the knee, or possibly have an ACL injury as well. This is actually probably going to be interesting for people who are healthcare providers who like testing the meniscus of the knee. So here's the study. It's called Validation of Thessaly, and I apologize about the pronunciation because I do use this test, but I've called it Thessaly for a long time. Validation of Thessaly Test for detecting meniscal injuries in anterior cruciate deficient knees. This was a study from 2009, which so isn't that old, but it isn't that new. But it's been a test that's been used for a little while. This is combining, it wants to see, this was mainly, again, in ACL deficient knees. So they found that with people with ACLs, this is a pretty good test. In people without ACLs, this is what the study is looking at, and it wants to see if there are a couple of tests which are better, which are called joint line tenderness, which you can look these things up. I'm sure there's other YouTube videos on it, as well as McMurray's test. So meniscal injuries are very commonly found with ACL injuries, as well as MCL injuries. They usually call this the unhappy triad. This Thessaly test, which again you can YouTube and look up, puts the knee into 20 degree flexion and mainly simulates the cutting change of direction, which a lot of times creates these non-traumatic ACL and meniscus injuries. A lot of times these people are afraid of rotation. Now the ACL is a structure which limits it protects against rotation of the knee, because the knee does not really want to twist or else it'll start to break down. So in this study, they had, let's see, there was doctors testing Thessaly test, joint line tenderness, as well as McMurray's test. And those docs were actually blinded from the actual results if the person has a meniscus injury or not. Later on, they took these patients and saw that yes or no, they did have or not have a meniscal injury via MRI. MRI is very valid for finding ACL injuries, meniscus injuries. They roughly estimate between 92 and 94% can be seen for sure on an MRI. Now, Thessaly's test, they found actually it's fairly not useful with people with deficient ACLs, and they actually called it a useless method with patients with ACL deficient knees, and so they have actually stopped using it in here, and mainly because it wasn't sensitive or specific enough. So in this study, they found that, let's see, the accuracy of Thessaly's test in identifying meniscus injury in these types of patients was about 60%. So this figure was much less than the reported accuracy of isolated meniscus injuries, so people that don't have the ACL and all the other stuff going on, which the sensitivity was 89%, and the specificity, which means that it is correctly identifying what it's testing for, was 97%, which is really high. I mean, it's 97 out of 100 people that have the meniscal injury without ACL injuries would test positive on this test. So when you go into your doctor's office and they test this on you, they're pretty darn sure within about 3%. So the other two tests, let's see, joint line tenderness, sensitivity was not bad. It's roughly 67 to 76%, but the problem is it's not very specific. So it's 13 to 49%, they estimated. So it can identify something's there, but it doesn't tell you exactly what it is. It could be a few things. McMurray's test was on the flip side. It was very specific. It was 58 to 100% specific, like it tells you exactly what it is. But it's not very sensitive, so it'll miss some of them. So it said 29 to 63%. So I thought this was a very interesting study. I was actually not familiar that ACL patients would have a low sensitivity on this test if I'm looking for meniscal tears. So look these things up. Again, the tests are Thessaly's test, joint line tenderness of the knee, as well as McMurray's test. These are things that a lot of your docs and therapists will use to identify the health of your knee and give you beyond reasonable doubt whether your meniscus is traumatized or not. Meniscus injuries are very tricky because they are cartilage injuries. Cartilages don't heal well. If you've watched my other videos, you'll understand why. I won't go into the specifics of it today, but in closing, they basically say that we should use caution in this, using Thessaly Test with people that have meniscus and ACL injuries. So, hope this was helpful. I know this one's a little bit more tricky terminology than the other videos. I do try to interpret these things as well as I can. If you have questions or comments, feel free to contact me on the P2 Sports Care site, or you can go onto our podcast, which I try to break things down very easy on there. It's on iTunes. That is Performance Place Sports Care Podcast, or just go onto YouTube, because a lot of these things I do kind of look through the feeds. I get a lot of them, so I don't always respond to every single one, but I do my best. So I hope this was helpful. If you want to hear other types of topics, just tell me. But until then, I'm just running through the stuff that kind of lands on my desk. Talk to you guys soon.